Good afternoon, everyone. My name is Stephen Weber, and I am the Director of Marketing and Client Management with USI Affinity. I'd like to welcome you to our webinar presentation today, presented by the American Bar Association for ABA Law Student Members. Both the ABA Insurance Program and our partner eHealth are very happy that you are able to join us today on this discussion. Our topic today is understanding and navigating health insurance, a Q&A session for ABA Law Student members. We expect the presentation to take about 15 minutes, and then there will be some time afterwards to answer many of your questions that have already been submitted. Please be sure to keep your phone on mute during the presentation to prevent any background noise on the call. Throughout the webinar, if you have any questions, please be sure to type them in the Q&A box. During our Q&A session at the end, we will read through as many questions as we can, and we'll answer them to the best of our knowledge. At this time, I want to go over the agenda that we have planned, which begins with a brief introduction to our panel expert, a little bit about the partnership eHealth has to the ABA Insurance Program, who is eHealth, the Affordable Care Act, coverage types and qualifying life events, and last but not least, a question and answer session. The ABA Insurance Program, administered by USI Affinity, is partnered with eHealth to offer health insurance for individuals like you. eHealth, through the ABA Insurance Program, is a member resource and can help you find affordable coverage nationwide from many insurance carriers. Whether you're new to shopping for health insurance, already have a health insurance plan, or perhaps a situation or a new change has occurred, eHealth is there as a resource to guide you when it comes to the decision-making, when it comes to individual and family medical coverages. And they do provide white glove service through the life of your policy as well. So they are a great resource you have access to as an ABA member. Now for an introduction to our panel speaker, Nathan Teater. Nathan is a manager of individual and small health insurance and has been with eHealth for over 11 years. Nathan has been following and keeping a finger on the pulse on health insurance coverage over the last decade and the many changes to the insurance environment. Once again, let me say welcome and thank you for attending. At this time, I will turn the microphone over to Nathan Teater. Thank you for being here, Nathan.
Yeah, thank you, Stephen. And yeah, thank you, Tracy. And thank all of you for taking some time out of your day to go over a very important topic. So I'll just go over a little bit about who eHealth is, where we're at in America with health insurance, and then leave it up to you guys if there's any specific questions that you have on your mind. So who is eHealth Insurance? I guess our mission statement says it the best. Our mission is to connect everyone with quality, affordable health insurance. We're an online health insurance marketplace where you can shop, compare, and purchase from all the different carriers in your area. And we don't ask for any personal information to look up plans. Zip code and dates of birth, all that's necessary in order to go ahead and look at different things. We have licensed agents that are non-commission based at a phone call away, or you can chat with our licensed agents that also can assist you in some of the different questions that may arise. But we've been doing this now for over 20 years and have insured over 5 million people across all 50 states in America. We work with over 200 carriers across the country. And all of our applications are just done right there online, safe and secure, and directly to whatever insurance carrier you ultimately choose. And the average time to complete the application process is about 10 minutes. So you're not wasting a long time completing that. You can go to there we go. The Affordable Care Act. So prior to 2014, it was really at the will of the insurance companies on what they wanted to cover with insurance plans, as long as they registered those with the state. And so the federal government in 2014 passed a law called the Affordable Care Act that brought up some framework to be able to issue a plan or offer a plan in the United States. Now they have to go with the 10 essential benefits that have to be covered, whether that's on exchange or off exchange, anything in the individual market or in the small business. They have to offer these 10 essential benefits. And those are hospitalization, emergency services, laboratory services, maternity and newborn care is a big one. Prior to the Affordable Care Act, this was really hard to find in a lot of the states across the country. And a lot of the states put waiting periods, or insurance carriers put waiting periods on covering maternity. So it was a big one. In mental health, substance abuse, disorder services, and behavioral health treatment was another big win. A lot of the insurance carriers wouldn't treat that as well prior to the Affordable Care Act. Again, prescription drugs have to be covered, any habilitative or rehabilitative services and devices, preventative and wellness services and chronic disease management, including all the preventative labs, have to be all covered at 100%. Ambulatory patient services. And then for those that have children on these plans, they have to cover the children's pediatric service and vision care. So also with the Affordable Care Act, to make it a little easier to understand, you can go to the next slide, I'm sorry. They wanted to group them into 4 different categories so that individual consumers could understand what their percentage would be covered. And so this act made it mandatory that these insurance carriers put their plans in these 4 different metallic levels so that an individual would know if they're purchasing in this level, how much would be covered right off the bat. So in the platinum, that's the most robust. Platinum will cover, your insurance carrier has to cover 90% of the costs right off the bat. Gold plans, 80%. Silver plans, 70%. And then bronze plans, 60%. Now, that's prior to hitting an out-of-pocket maximum. So what the Affordable Care Act also said was, yeah, these are prior, the percentages that the insurance company will cover prior to hitting your out-of-pocket max. But every plan has an out-of-pocket max that once you hit that, whether it's platinum, gold, silver, or bronze, the insurance carrier then has to cover 100% of the costs. So there is a maximum on that 30% or 40% in a silver or bronze. Once you hit that out-of-pocket maximum, the insurance carrier is then on the hook for 100%. Another thing that came along with the Affordable Care Act was not being able to disqualify people or increase their rates or put waiting periods on any pre-existing conditions. So that was done away prior to the Affordable Care Act. People could be denied health insurance. Insurance companies would say they're not going to cover a pre-existing condition or prescription drugs that came with that, or they would increase the rates so much that it was hard to afford. So with that, they had to come up with something that would keep people from just purchasing health insurance when they became ill or sick or hurt, because that would just drive the costs through the roof. So there is an open enrollment period, which is every year from November 1st to December 15th, that you can purchase any insurance plan you'd like for any reason at all. Again, there's no underwriting or anything like that, so they cannot deny you coverage or put waiting periods on anything. If we're outside of that open enrollment period, you can still purchase it, but you have to experience a qualifying life event. And there are 4 basic types of qualifying life events that they've come up with. The first is the loss of health coverage, and this is losing existing health coverage to no fault of your own. If you stop paying your health insurance, that's not a qualifying life event, but it's losing it no fault of your own. So that's including job basis, individual, student plans, any credible coverage. The loss of Medicare, Medicaid, or CHIP, or those individuals that are turning 26 and aging off their parents' coverage, also is a life qualifying event. Another qualifying life event is a change in the household. So somebody gets married or divorced, somebody has a baby or adopting a child, or an unfortunate death in the family. That's also going to give you a qualifying life event. Changes in residence, you move into a different zip code or a different county, that triggers a qualifying life event. Some of the insurance companies and plans only cover certain zip codes or counties, and just going to another county will qualify you for a life-changing event. A student moving to or from places they attend school, seasonal workers moving to and from the place where they both live and work, moving to or from a shelter or other transitional housing. There's some other qualifying events, changes in your income that affects the coverage. So that would be like if you lost Medicaid or something of that nature. Also gaining membership in federal recognized tribe or Alaska Native Claims Settlement Act. corporation shareholder, becoming a U.S. citizen, leaving incarceration, that's jail or prison, or American Corps members starting or ending their service. One thing to point out about qualifying life events is it triggers a 60-day window prior and after. The one thing that we get asked a lot about is the birth of a child. You do have to wait till the child's born in order to apply for a plan, but they will backdate it to that date of that child being born. So any services or bills that come through by law, they have to backdate it to the birth of the child. And also it came along with the Affordable Care Act was that a lot of the uninsured couldn't afford health insurance. And so along with the 2014 Affordable Care Act, there was subsidies that could be purchased on healthcare.gov or a lot of the state exchanges. And the law says that families earning less than 400% of the poverty level, and that's approximately $49,000 for a single person or $103,000 for a family of four, you could probably qualify. And I won't go through all of these levels, but I'll just explain kind of how it works. So the benchmark plan, that's the biggest question that we get with this law. A benchmark plan is actually the second least expensive silver plan that's available to you in your area. That's what the cost basis of a benchmark plan is. So it's the second least expensive silver plan. And from there, they go on the percentages on what your cost is out of pocket and then where you might qualify for a subsidy. So as you can see, if you're over the 400% mark, then state Medicaid and things like that come into play. So this was to close that donut hole from people that didn't qualify for Medicaid or their state insurance, but still couldn't afford health insurance outside of that. And that's how they came up with these different levels. And as you can see, some of them can save people quite a bit of money. And recently, this has also changed. And with it came the American Rescue Act. So what they found is that people still were not able to afford insurance, especially with some of the things that have happened in the last year and people losing their jobs. So President Biden signed into this act in March 11th of 2021. And really what it does is improve the access to the affordability of the health coverage through the marketplace by helping more financial assistance to help pay for coverage. It also opened up a special enrollment period that we're currently in. So we did have open enrollment that came and went, but it reopened it from April 1st of this year to August 15th is an open enrollment period where anybody for any reason can purchase health insurance plans. And the biggest change was instead of that 400% poverty level, they said anybody, any household will not pay more than 8.5% of their household income towards the cost of their benchmark plan in area. So it actually opened up for about 2 million individuals in America that can now apply for a subsidy that weren't able to prior to this law being in place. And just today, healthcare.gov sent out a thing that said they've now insured over 1 million of those people as a result of opening this back up. Those subsidies are, the new law is only going to be in effect for now from 2021 and 2022. After that, it will go back to the other unless it is extended. But that's the gist of what that law is for what it does for affecting the health insurance and as far as the subsidies are concerned with that a rescue plan. And I'd love to open it up for questions because I know it's kind of a lot that's been taken in there, but any questions at all, I'd love to answer.
So yeah, as I mentioned earlier in the Q&A box on the bottom, you'll be able to enter those. Nathan, we did have some questions that came in during the registration process, so I'll start asking some of those, and then as more come in, we'll address them.
Yeah.
So we'll kind of start from the top here. What should you do about healthcare when aging out of my parents' plan over the summer?
Yeah, great question. So that triggers a qualifying life event. You won't need it this summer because we do have the open enrollment until August 15th. But you have 60-day window prior to aging off your parents' plan and 60 days after. So we usually recommend usually purchasing and shopping right 30 days prior to aging off. That way you can apply and make sure that your cards and your new policy come out. So there's not a gap in insurance. The 30-day window is usually the best time to do that.
What are options if I don't necessarily have a job lined up just yet after graduation?
Yeah, so you definitely want to go to check out, the subsidy. Those could be available to you. There's a bunch of state programs if you don't qualify for that. But there's also other things that you can look into. We have licensed representatives that are across the country. So if you go to the site and don't really understand your options or can't figure out what way to go, again, we have unbiased, non-commissioned licensed agents that can assist you with those one-offs as well for your specific situation.
I think here's a good question. What is the main difference between a short-term medical plan and then what's something you would enroll in through the ACA?
Sure. Yeah. So every plan that's available to you, whether it's short-term or major medical, is on a month-to-month basis. So you can cancel anything at any time. You're not locked into any contracts or early closure fees with any of the plans. Short-term plans are less expensive. They do come with some caveats, though. We always side on the air of caution with those. They don't cover pre-existing conditions. They are for specific periods of time, and when that time ends, you become uninsured, and it's not a qualifying life event when you lose a short-term plan. We always side on the caution of major medical because they're on a month-to-month, but some instances a short-term plan may be right, but those are also available.
How can I apply for a health insurance plan through the American Rescue Plan?
Yeah, so the American Rescue Plan is just an act that opened the qualifying life event. So you can go anywhere you'd like. Really, you can shop and compare on our side directly to the insurance carriers, healthcare.gov, or your state exchange. All of them are now open. It's just opened it back up for you to purchase a plan that's most convenient to you.
I just turned 26. What are some red flags I should watch out for when shopping for plans?
Yeah, you never want to pay for more than you need, right? So that's one big red flag. If there are health concerns or prescription drugs that you're taking, or you want to go in for preventative services and things like that, stay away from the short-term plans. You'd want to stay into that major medical section, especially with so many financial ways of making them into affordability right now. I would say be careful of the non-Affordable Care Act plans when you're shopping, or if it's too good to be true type of thing. That's always the case.
What are the difference between plans on healthcare.gov and plans that would be available through eHealth?
Great question. So we do both. So on exchange plans are usually typically those ones that have a subsidy, but the plans that are off exchange, they don't do subsidies, but we actually do both at eHealth. So we can not only assist you with the subsidy route to help you get the subsidy with healthcare.gov, or on our website off exchange, where if you don't qualify for subsidy, we can also help with that. And one thing I want to point out about all the insurance plans that are out there is it's all federally regulated price-wise. So whether you go through health insurance or healthcare.gov or directly do the insurance carrier, the prices do not change. That's all federally regulated. There's no additional cost to go through a broker or anybody for that matter.
Here's a good question. If you're studying for a state bar outside the jurisdiction you live, where should you seek coverage?
Yeah, great question. We get that all the time. So the best thing that we always say is where you're at, where you're living, where you're staying. Most likely, if something happens to you or you want to go see a doctor, it's best to do it where you're at currently. Any plan across the country that's an Affordable Care Act plan will cover you no matter where you're at in America or outside, if it's an emergency situation. So you don't have to worry about in or out of network if an emergency occurs. But typically, if you are living somewhere, we'd always say get a plan there. And then if you do move, of course, that's a qualifying life event. And then you can change your plan as when that time comes.
Here's a question that came in, and I think I'll phrase it a little different for you, Nathan. When it comes to the term state exchange or federal exchange, what's the difference and why are some states different than others?
Yeah, so some states decided that they want to control basically the funds that come in from the federal government and how they distribute to their individuals and things, there is no difference. So all the cost basis for the levels of which you might qualify for a subsidy are the same. Some states just decided to do it on their own and take those federal funds and use them how they wanted to instead of not getting those. And so there are a few states that do that, but there is no difference in whether you go through federal marketplace or the state exchange. It's the same thing. They just have their own exchange instead of the federal marketplace.
So you kind of addressed this, but I think it's just important again. What if you don't know where I will be living? I'm looking for jobs in multiple states. And I think, you kind of talked about it, but elaborate a little more if you can, Nathan.
Yeah, no problem at all. Again, when you do hone in on that, triggers a life qualifying event. So what we always recommend is wherever you're at looking now or losing coverage or where you need it, I'd purchase it where you're currently at because they're on a month-to-month basis, and a move is a qualifying life event. So you can easily, 30 days prior to the move, start shopping for insurance and make sure that's in place so that when you do eventually move to the new area, there's no break in coverage.
So I'll have a two-part. I'll add to that question there. And when it comes to the type of plans, they have regional carriers and national carriers. Is that something that you might want to look at more closely when it comes to selecting if you know you might be potentially moving? Could you keep a same plan knowing that you are moving potentially in the future?
You could. You could definitely look into that to see if it's a more national type of coverage that could cover you where you go, or more regional. And that's what's great about a website like eHealth Insurance, where you can kind of look at the differences and call somebody that has expertise in that area and let you know what may be best for you in that situation. But rest assured, like I said, in an emergency situation, God forbid, any plan that's Affordable Care Act anywhere in the country has got you covered.
And then the last part of that question is, anytime that you do change your plan, Nathan, you would have to start from the beginning when it comes to your out-of-pocket max, correct?
Yes, so that is the drawback there, right? So unfortunately, they're based on a calendar year. So if you were to move halfway through the year and you met your deductible and had to change, that would be something you'd want to consider prior to making the change.
What's the difference in benefits / drawbacks of after-tax or pre-tax plans and point-of-sale prescription plans? Is it possible to change a plan after picking it?
So you can switch a plan as long as you're in that 60-day period from a qualifying life event, or if you're in that open enrollment period, you can switch as much as we want. So as much as you want there. Once open enrollment's closed or that qualifying life event has gone by, then unfortunately, you can't switch plans unless you have a qualifying life event. And then the first part of the question, that was pre-tax. Could you repeat? I'm sorry, I missed that part.
Sure. Yep. What's the difference in benefits drawbacks of after-tax or pre-tax plans and point-of-sale prescription plans?
Sure. So there's HSA style plans, and I think that what's may be going on there are high deductible plans where you can put money into an HSA. The health insurance portion, there's really no difference. So health insurance is health insurance, but there are plans that are designated as HSA or health savings account allowable. And what that allow you to do to put money into a bank account that's designated as an HSA that you can put money in. It grows tax free. When you take it out, you don't pay taxes on it as long as it's for health related purposes. And that's just on a determining factor on where you're at, maybe in consideration for your tax bracket. You're trying to save some money there, or you're really healthy and you don't think that you're going to, really need and want to save for future things. That's also what we see with those HSA style plans. Hopefully that answered that question.
Are there plans that include dental and vision insurance?
None of them do. The nice thing is that there's plenty of options no matter where you're at in the country, and you can actually buy those standalone if you'd like also. On our site, we have that standalone if you'd like, but no plans unfortunately come with all that in one. They do for children for preventative services. So a child could get a vision checkup and teeth cleaning and x-rays and things like that for children, but nothing for adults.
What is the difference between deductible versus out-of-pocket max?
Yeah. So deductible is usually the amount that you have to reach before the insurance company kicks in. And then sometimes there's a split of, like we talked about, the metallic levels where you're responsible for 20% of the cost. The insurance carrier covers 80% of the cost, but there's a max that's out of your pocket. So even if you have an 80-20 split, they put a cap on your 20%. So you'll never go above your out-of-pocket max. So every single plan has an out-of-pocket maximum, and that's the absolute worst case scenario for you. After that, the insurance company has to cover 100% of the cost of everything.
Is there a typical healthcare plan which is normally recommended for recent graduates?
Everybody's so unique. It's best to just we take it on a base that, everybody's so different. So somebody's health in that situation could be completely different than the next call we get, or next person that's shopping for insurance or looking for insurance. So it really isn't one that we kind of gravitate towards. I can tell you that overall, the most bought plan across the country that we see also on our site is the silver plans. That seems to be where people find to be more comfortable, where you have a copay for a doctor visit and then prescription drugs and then a deductible if God forbid something were to happen.
Here's another good question. Would there be any reasons for rejecting an employer-provided insurance?
Not necessarily, because employers by law in most states have to cover about 50% of the cost of your insurance. Now, they don't have to do that for a spouse or dependents in a lot of states. But as far as the affordability factor, if it's hard to beat that outside of an employer plan, because the richer the benefits and the cost of it. The only time we see people going outside is usually sometimes a spouse with dependents and things where an employer isn't contributing to theirs, but only to the employee. But most of the time, the right thing is an employer-sponsored plan when you're employed.
Here's a good question. Is the typical open enrollment period still going to be the same time this year, or do you think they're going to extend past the August 15th deadline?
That's a great question. So it's right now. We've heard nothing that November 1st will be to December 15th. There has been talks about it changing to this time for the future around tax time, but there has nothing been passed or anything like that. It still is, as of now, November 1st through December 15th.
Helpful. Well, at this point, we've went through all the questions. If anyone has anything else, feel free to type it in. We'll give you a few more moments here. And while we'll wait, I'll talk a little bit about, for you being an ABA member in the Law Student Division, there is a link in a resource. As stated earlier, eHealth is really the resource for you to guide you. So you could get more information at abainsurance.com/student-health. You can call that phone number listed there. Or if you wanted to connect with Nathan directly on any questions, he'll be able to assist in passing to members of his team, but that's his email address listed below. And as Nathan mentioned earlier, and maybe it might be important to call it again, what is the basic information that someone would need to provide in order to get a quote based upon where they're located? Just talk through it one more time, Nathan, if you can.
Yeah, no problem at all. Yeah, there's not much information at all, as you can see on the screen there. It's basically, they ask for your zip code, and then they'll just ask for date of birth. There's no information that's needed more than that to shop anywhere. If you land somewhere that asks for more than that, I would be hesitant in putting any information prior to hitting the apply button with the insurance plan, for sure.
Here's a question that came in. If I buy coverage through your site and have issues with the plan, can I call you to get help?
You can. That's one of the nice things about using, because there's no additional cost. Like I said, if you go directly to an insurance carrier or through us, we do have a customer service as long as an enrollment team here that assists our clients. This is just another way of talking and helping you through that process. Instead of you having to go directly to the insurance carrier and hope that they're doing you right, we're actually on your side as well if you go through us.
Wonderful. Well, at this point, I think that's all the questions we have. So the presentation is complete. If you did have any other additional questions, the contact information, phone number please be sure to call or email Nathan directly. But I want to thank everyone for attending. Thank you, Nathan, for presenting and sharing information. And I wish everyone to have a good rest of your afternoon.
Thanks for having me.